Good morning, everyone. Welcome here. Thanks for joining us. We've got people coming in from the waiting room right now, and so we'll just give folks a minute or two before we launch into the presentation for today. Thanks again for joining us. Okay, so I think we'll get started now. Welcome, everyone, and thank you for joining us for today's report launch. My name is Ainsley Krone, and I'm the acting Manitoba Advocate for Children and Youth. My office is an independent member of the Manitoba Legislative Assembly, and we're responsible for advocating for and representing children, youth, and young adults in the province. I just want to let you know that we're going to be recording today's presentation for possible replays on our social media and our YouTube channel. So I'd ask that you just keep your microphones muted during the presentation, but we will have time for questions at the end, at which point I'm going to invite you to unmute yourself and jump in. So normally at this point, I would introduce our knowledge keeper, Cheryl Alexander, to open us up in a good way with a prayer, but unfortunately Cheryl is under the weather today, so we send her all of our good wishes and look forward to seeing her again here at the office really soon. I want to start by acknowledging that the mandate of our office extends across the province that's now called Manitoba. As an office, we therefore live and we work on the original lands of the Anishinaabe, the Anishinaabeg, the Dakota, Oyate, Denisulan, and the Haitawak. We acknowledge the part of Manitoba is also located on the beautiful homeland of the MACY Nation. We strive every day to dedicate ourselves and the public resources that we're given to making meaningful contributions to the lives of all children and youth in our province, but especially to the lives of First Nations, Métis, and Inuit young people in our province. And we do this in a lot of different ways. We do this by listening to the voices and opinions of First Nations, Métis, and Inuit young people in our work, by ensuring that our staff team reflects the diversity of identities and families that we serve, by consulting with community members outside of our office, by working in collaboration with the diversity of Indigenous peoples who live here, and overall to ensuring that our office embraces and that our work reflects a philosophy of continual learning and growing in a spirit of reconciliation and collaboration. We've recently released a framework and a work plan for reconciliation, and you can find that on our website. It's a document that we've released as part of our commitment and our statement of organizational accountability. And we invite anyone to provide feedback to our office about what it describes and what it contains. So just a little housekeeping before we get started. You can certainly make use of the chat feature on the Zoom to talk with us and to talk with one another. Again, just a reminder to please keep your microphones muted during the presentation to avoid any distractions or noise. And if you have any questions during the presentation, you can type those into the chat in the Zoom. Or if you'd rather voice your questions out loud, as I mentioned, we'll have time at the end for a bit of a Q&A. So today I'm presenting our annual compliance report assessing government progress on implementing recommendations that have been made by the Manitoba Advocate Office. This is the second time that we're releasing such a review. The first time was last November with the report entitled, "Are They Listening?" And that's one that we released in 2020. One of the responsibilities of my office under the Advocate for Children and Youth Act is to monitor government compliance with recommendations made in both investigations and special reports that are released under our legislation. This is a really important role for our office that ensures that the reports and investigations that we release do not just collect dust on shelves, but that there's an accountability mechanism to ensure recommendations are implemented so that services improve and children and youth are better protected and served in Manitoba. Last year, we introduced a new method for measuring government compliance, and we've made that handbook and our compliance measurement process available to the public, and you can find that on our website. We are committed to fairness, to transparency through this process, and also to ongoing communication with government departments. My goal with the release of this report is to advocate for necessary changes for services for children, to provide reliable and data-driven information to the public in order to increase their understanding and their trust of public services, and finally, to be fair and collaborative with the government departments in our analysis of services and changes over time. So today I'm going to start with a brief overview of our compliance assessment model and methods. Next, I'm going to discuss the overall summary findings of the compliance assessment process, including findings by systemic issue and findings by department. I'm going to then discuss 3 key areas where there are opportunities for the government to enhance its compliance. And then last, we're going to have time for questions and answers. Importantly, today's presentation primarily focuses on providing you with a high-level summary of our compliance assessments. The more detailed compliance analyses continue to happen year-round by members of our quality assurance team, along with provincial government officials who are tasked with implementing recommendations that emerge from our work. So looking at the compliance model, the objectives of our model are to first ensure accountability for the public, transparency in our process of assessment, consistency in assessments across recommendations, and then also comparability between recommendations and with recommendations over time. Secondly, the objective is to provide a standardized process that guides the policy analysts on our team who are tasked with monitoring recommendation implementation. And then our third objective is to articulate the procedures to guide public bodies through the compliance process. As mentioned, the responsibility to monitor the implementation of recommendations is enshrined in the Advocate for Children and Youth Act, which was proclaimed in March 2018. And specifically, it's found in section 11(1)(d) of that act. The monitoring process applies to public or non-public investigations following the death of a child, and also to recommendations made publicly through a special report. Recommendations made in investigations that were made prior to the proclamation of the ACYA in 2018 are monitored using a pre-existing process. And so those recommendations are not going to be a part of my presentation today. I'm going to give you an overview now of our compliance methods. We have a handbook, as I mentioned, that's accessible online with more details, and you're seeing the process now up on your screen. So this year we received the majority of written submissions detailing actions on our recommendations by May 31st. And that's an annual deadline that we give to the provincial government departments to respond and to report to us. So this year, Manitoba Health and Seniors Care requested additional time, and so we gave them until the end of July, and that was due to COVID-19 pandemic-related delays and resource constraints that are within that department right now. Without surprise, COVID impacted many departments, delaying progress on some of the work associated with some of the open recommendations. So once we receive information and evidence from government departments, what we do is we conduct a pre-assessment, and then we communicated initial questions to government representatives in meetings that we held with them. The pre-assessment allows us to really quickly identify if there is any missing information or other initial questions that we need prior to conducting a full assessment. Following those meetings, policy analysts from our team drafted their assessments, and an internal peer review process occurred to ensure consistency across assessments in each of the departments. That was followed by an internal compliance determination meeting where assessments were discussed in more significant detail, and then we finalized those. When a recommendation was deemed to have an assessment where significant work was still outstanding to be completed, we provided our assessment to the affected government department, and an additional opportunity was given to the government department to provide information or clarification to influence the compliance level. Some departments did then provide additional information, which resulted in changes to their compliance assessments. In November of this year, I presented the summary analysis to deputy ministers and senior representatives from the Departments of Families, Health and Seniors Care, Education, Justice, and to the new Mental Health, Wellness, and Recovery Department. This was an opportunity to discuss larger trends in recommendation implementation and really what we're seeing in terms of changes over time for children here in the province. As this recommendation compliance work is ongoing throughout the year, as you see on your screen, our next meetings and our ongoing conversations will be happening early in the new year, and that's when a new cycle starts again. The compliance scale, which you're seeing on your screen, is a general description of how compliance with MACY recommendations is assessed based on relevant criteria. Upon review and analysis of departmental actions and the evidence that they submit to us in accordance with the recommendations intent, and numerical value and a compliance level are assigned. So the levels, the 7 on your screen right now, I'm going to just walk you through how we come to each one of those. So fully compliant, or 100%, which means that public body complies entirely with the requirements of the recommendation. And really, there's no more work that's required on that particular recommendation. Largely compliant means that requirements have been met almost entirely, and only negligible requirements remain to be implemented. For example, there might be an outstanding policy document or a final action that would conclude all activity associated with the recommendation. So partially compliant, or 50%, means that the most important requirements have been met. There might be certain deficiencies that affect the adequacy of the implementation, but without resulting in a situation where the given recommendation has not been acted upon. Limitedly compliant means that the requirements have been fulfilled to a limited degree, but there's still a significant amount of work to be completed on the implementation. Non-compliant means that almost none of the requirements have been met, even if steps have been taken towards implementation. So this might be the determination if, for example, work on a new initiative is required and the action reported is that a meeting has been scheduled, but no substantive work has yet occurred on the issue. Non-compliant is also the category that we use if there's no action reported by the government, or if the government has not responded in any way to the recommendation. Our 6th category is insufficiently explained, which means that the explanation given to us by the government for the lack of movement on the recommendation is not sufficient to justify the inaction, or the reported actions do not meet the intent of the recommendation. And then sometimes the government has a reasonable alternative solution that they're proposing that would meet the intent of the recommendation that we've made, even if the specifics might be different than what was originally recommended. So this can happen, for example, on some of the larger systemic recommendations that we know are going to take some time to act on. And in that time, stakeholders may change, or departments or organizations may be reorganized, meaning the response will need to look a little bit different. So when this happens, we can assign alternative solution, which means that it is a complete and well-reasoned explanation for the lack of implementation of the original recommendation, and a different action has been proposed, which meets the intent of that original recommendation. So for this report that I'm releasing today, we assessed a total of 51 recommendations from 7 special reports that we published between October 2018 to May 2020. Of the 51 recommendations, 49 of them were made to the government of Manitoba, and we made 2 recommendations to the government of Canada. And before I present the findings, I want to take a minute to just acknowledge the hard work and the dedication and the cooperation of civil servants from central government with whom we work and are privileged to work every day on behalf of kids. My team and I are really grateful for those ongoing working relationships, and that we can come together towards the best outcomes of children. Although some of the compliance assessments that you're going to see today are low, we know that a lot of work is continuing to happen behind the scenes to address our recommendations. Overall compliance with recommendations this year is relatively low, but it is comparable to last year. 43% of recommendations are on the yellow or green side of the scale. This means that actions reported are aligned with the intent of the recommendation and meet at least some of the requirements for implementation. So in short, they're on their way to full implementation. 4 recommendations are now deemed fully compliant, including 2 recommendations completed this year and 2 which were completed last year. The majority of recommendations are considered limitedly compliant, and that's what you're seeing on your screen right now. This means that some actions have been taken and reported, but they do not meet any of the requirements of the recommendation yet. There are 7 non-compliant recommendations, which, as mentioned, means that the government has taken no action that meet the requirements of the recommendation. And there's 1 recommendation considered insufficiently explained this year. And this year, there are no recommendations in the alternative solution category. So let's look at some more of our detailed analysis. What you're seeing right now on your screen is compliance by systemic issue. We analyze compliance levels in several different ways, including by systemic issue attached to each recommendation. This allows us to see progress on larger systemic issues in our province. As you will see here, the closure of recommendations from last year related to victim services and pepper spray, both issues under the mandate of Manitoba Justice, continue to be reported this year. The graph also shows the largely compliant status of recommendations that called for our office's enabling legislation to be brought fully into force. This progress was due to the government proclaiming the expansion of reviewable service areas on June 1st of this year. Other areas of good movement include an increase in the government's compliance with recommendations that address chronic absenteeism and suspensions. Recommendations regarding the use of segregation and solitary in youth custody facilities have not shown any progress since last year, so they remain at 30%. This past June, we published an update to our 2019 report on the use of segregation and solitary confinement, and you can find that one on our website, and it's called Breaking the Cycle. Unfortunately, the systemic issue that has the lowest compliance rate is related to safe sleep or safe infant sleep. This is an important and it's an urgent theme that I'm going to be discussing in more detail later on in this presentation. While overall compliance with all recommendations was low at 43%, there were some noteworthy differences in compliance by department, and that's what you're seeing up on your screen right now. Manitoba Education is the department with the highest compliance levels this year. The department made significant strides to put the Manitoba Advocate's recommendations into action, particularly with the release of the report by the Commission on K-12 Education and the release of the subsequent strategy. as well as its work to promote mental health literacy and safe and caring schools on belonging and safety. At an overall compliance rate of 75% in comparison to 42% last year, Manitoba Education has made significant progress in its recommendation compliance, with really minimal work remaining for full implementation of recommendations that have been reviewed over the past 2 years. Many of their outstanding recommendations are near completion as well, with expected completion dates into 2022. Ultimately, Manitoba Education has demonstrated enhancements to mental health promotion in schools and also to the promotion of policies to address bullying. Manitoba Justice remains at 45% compliance rate. Last year, both fully compliant recommendations were from the Department of Justice. With no significant action since then, however, compliance determinations on the issue of segregation and solitary confinement have remained the same as last year. With the establishment now of the Youth Justice Division and work beginning on the Youth Justice Review that was called in 2019, we see this as a positive signal and an opportunity for the government to move towards implementation of outstanding recommendations in the areas of segregation and solitary confinement. And we're really looking forward to more activities being reported by the department in the next round of assessments. Manitoba Families has a lower compliance rate with recommendations, but it has improved since last year. Families is now at 43% average compliance compared to 35% last year. The department was able to move 2 recommendations up a full compliance determination level with their work to modernize standards and pilot new training initiatives, as well as significant progress to develop a protocol for missing children in care. This year, we saw a significant improvement also in the quality of responses and actions taken toward the implementation of advocate recommendations. Manitoba Health and Seniors Care continues to have the lowest compliance rating, with an average compliance rate of 25%, which is the same compliance rate as last year. The low compliance rate for Manitoba Health and Seniors Care is associated with the low compliance rating for the sleep-related infant death recommendations, many of which were addressed to this department. Of course, it's also important to put this into the context of the massive effort of the pandemic response that was primarily shouldered by the health department, and which we know pulled resources from across the civil service, but saw the most significant redeployments happening within health to respond to the pandemic. With the creation now of the Mental Health, Wellness, and Recovery Department, some of the recommendation response work will logically shift to rely on staff from within that department. And I know that health and mental health are working to coordinate many of their efforts. So while the mental health department is not named here in this slide, my team is in regular communication with staff from the new department to support their recommendations activity work. And on that note, many recommendations do focus on the mental health needs of children and youth, given it is an area of the public service that is in significant need of investment and development. What I want to highlight also today is that compliance of recommendations to improve mental health and substance use treatment services have not progressed significantly since they were issued. This is, of course, with the exception of the development and funding of youth hubs, which is important and noteworthy. But what we do know is that significantly more work and investments are needed to adequately respond to the growing mental health and substance use issues in the child and youth population. Our child death review and investigations team, as well as our advocacy services program here at our office, continue to see mental health and substance use treatment as an area with significant service gaps and growing wait lists for children, youth, young adults, and their families in Manitoba. And I'm hopeful that the new Department of Mental Health, Wellness, and Recovery will be quickly getting to work on many of these outstanding needs in the mental health system for children and youth. So as we went through our analysis this year, there were 3 key themes that emerged that offer really important opportunities for the provincial government to enhance its compliance with the 51 recommendations. The first key theme is that recommendations to address preventable sleep-related infant deaths have very low compliance rates. So first, a little bit of background on this issue. In March of 2020, as some of you will know, our office collaborated with the Office of the Chief Medical Examiner and the First Nations Health and Social Secretariat of Manitoba, among other stakeholders, to publish the first ever 10-year retrospective research study into sleep-related infant deaths in the province. The findings led us to a set of 13 recommendations to both the Government of Canada and the Government of Manitoba's Departments of Health, Justice, and Families. The recommendations that we issued were described by public health professionals and experts as a roadmap to reducing preventable infant deaths. They are designed to work together and enhance a whole of government response to preventable infant deaths by enhancing resources, information, and supports to families, and training for service providers. Despite the roadmap, recommendations in our Safe and Sound report received the lowest compliance assessments by primary systemic issue and by report, at a total compliance rate of just 13%. So we're going to put the table up on your screen right now, which is just a bit of a summary. Just the next slide, please. Just a bit of a summary of the 13 recommendations. Thank you very much. And so as you can see from this table, for 7 of the 13 safe sleep recommendations, no actions were taken by the provincial government toward implementation in the past year. For 5 of the 7 recommendations issued to Manitoba Health, we received the following response, and I'm going to read it to you now. So Health told us, the public health branch has been committed to responding to the current pandemic and will be able to return to regular and routine work, such as responding to these recommendations once the COVID-19 vaccination campaign has been completed and has moved into the universal ongoing public health systems and processes. So this resulted in no action being taken towards implementing these recommendations that you're seeing on your screen. And also with Health and Seniors Care, Manitoba Justice, and the Government of Manitoba self-reporting that they were non-compliant for these particular recommendations. The recommendation on sleep-related infant deaths with the highest compliance rate was issued to the Government of Canada, which was able to demonstrate action towards expanding maternal child health programs in Manitoba First Nations communities. The inaction towards these recommendations is concerning, especially 20 months after the release of those recommendations. Sleep-related infant deaths are not only a serious public health concern, but they are also a children's rights issue. What's really important to note with sleep-related infant deaths is the structural inequality that perpetuates many of them. Many of the infants that died lived in low-income neighborhoods and did not have access to a safe sleep surface or a culturally appropriate alternative in their home. And we continue to hear that the costs of safe sleep surfaces like cribs are prohibitive for low-income families in Manitoba. And through our investigations and child death review program, we continue to see far too many child death notifications of infants who are dying in unsafe sleep environments. We understand, of course, that the COVID-19 pandemic response has completely upended the public sector and has rightfully resulted in a reallocation of resources towards emergency responses. As we emerge from the pandemic, however, I urge the Government of Manitoba to look at this ongoing public health and children's rights issue. These are preventable infant deaths. As outlined in our Safe and Sound report, our rate of sleep-related infant deaths in Manitoba is 42% higher than in British Columbia. Manitoba Health and Seniors Care, Manitoba Justice, Manitoba Families, the Government of Manitoba, and the Government of Canada all have really important roles to play in prioritizing the implementation of these recommendations. In doing so, consultation with First Nations, MACY, and the Inuit and their governments is really critical. This year's compliance report also highlights the need for more collaboration and coordination across government with respect to recommendation implementation. And this is the second key theme in our report today. So as mentioned, of the public bodies to whom our office has made recommendations, the government of Manitoba as a whole has the second lowest compliance rating at 38%. In this year's round of compliance assessments, we found that none of the recommendations made to the Manitoba government as a whole have been fully implemented, and only 5 of the 10 recommendations have improved since 2020. When recommendations require more than one department to be involved in a response, we are finding that the work happens much slower. And this suggests to us the need for improved coordination between different areas of the government. In short, this can suggest that more work is needed to break down silos inside the government so that information and action can flow more seamlessly between departments. Manitoba children, youth, and their families receive services from multiple departments. Meeting their needs requires coordination and is the reason why recommendations often mention more than one department or stakeholder. A good example is in the case of a youth in Manitoba youth custody facilities, the majority of whom experience mental health issues and require supports. In fact, the Manitoba Youth Centre is actually designated as a health facility. And we find that in cases where coordination is needed, there are delays or inaction reported towards implementation of a recommendation. For example, the implementation of one justice recommendation, the details of which you're seeing on your screen right now. This recommendation from our 2019 report on youth justice, which is called Learning from Nelson Mandela, calls for the evaluation of the Manitoba Youth Centre as a mental health facility, as well as the development of specialized programming for youth with cognitive disabilities who are in custody. Manitoba Justice reported to us this year that movement of this particular recommendation is waiting on the new Department for Mental Health, Wellness, and Recovery to get established and to get up and running. While the new department has been created, the delay in clarifying its scope of work has stalled progress on this recommendation. In short, some recommendations require coordinated action, and this is an opportunity for furthering compliance and improving the effectiveness of services for children, youth, young adults, and their families. So the third key theme that I want to highlight today is that the government must avoid its habit of planning to plan, or the dragging effect of over-consulting. Since 2017, the government of Manitoba has announced 4 major reviews into child-serving systems in Manitoba, including the mental health system, the education system, child welfare legislation, and the youth justice system. Next slide, please. And that's what you're seeing. You're going to see on your screen in just a second is a table. There we go. There's my table. Thank you very much. So these reviews were referenced in the formal responses submitted to my office in June 2019, December 2019, again in June 2020, and most recently in May 2021. As you can see, reports and implementation plans have not been released for many of the announced reviews. The only exception, as you can see, is the Department of Education's review into education and kindergarten to grade 12 education, which is fully complete, and the department has also released the Commission's final report and introduced its strategy, which outlines a framework for implementation. Action by the Department of Health, however, continues to remain in the planning stages. The Virgo report, as Manitobans will recall, was released more than 3 years ago in 2018. And Manitoba Health and Seniors Care has announced 2 additional consultation processes and frameworks on its work this year. While some recommendations in the Virgo report have been implemented, Manitoba Health and Seniors Care reported to us that progress on putting recommendations into action is on pause until the conclusion of a national level process whereby provinces and territories are collaborating on a cross-Canada framework. Unfortunately, this could take some time and push needed changes here in Manitoba into the future. Considering the complex nature of interprovincial collaboration and multilateral consultations. But in the meantime, young people here in our province continue to wait And in too many cases, they are languishing inside a system that is known to be deficient by Manitobans and has been acknowledged as being such by the government of Manitoba. I know, of course, that there were a number of constraints experienced by Manitoba Health in the last year and a half. In particular, a shift in availability of resources, particularly with many Manitoba Health staff redeployed to respond to COVID-related issues. More specifically, 6 recommendations made to the health department reference COVID as a reason why work has yet to be begun on recommendations. And another reason for delay is associated with internal reorganization of departmental staff, divisions, branches, and units, and that's related to the reassignment to the newly created Department of Mental Health, Wellness, and Recovery. The Department of Health told us in response to 8 of its recommendations that they will be waiting for the development of that national framework before they are going to tackle provincial level work to inform and implement the Virgo-specific recommendations that came out more than 3 years ago, including those related to youth mental health and addictions. While I'm certainly encouraged by investments in mental health and addiction services, in particular, the recent funding of 5 youth hubs and the creation of the new Mental Health, Wellness, and Recovery Department, I remain really concerned by the lack of an implementation plan to address systemic gaps in current services serving children and youth who are in need of those services right now. Growing system pressure regarding child and youth mental health, for example, cannot wait until for some unspecified time in the future to see needed changes here in our province. Looking again at the slide on your screen, if we could just put that table back up there, please. 3 of the 4 child serving system reviews that the government of Manitoba has announced have not led to implementation plans or subsequent transformative changes for children and youth. Ongoing reliance on reviews without concrete plans of action afterward have continued to result in low compliance assessments for Manitoba Health and Seniors Care. Publishing the reviews and creating implementation plans to improve services has the potential to enhance compliance assessments with recommendations, and of course, most importantly, advance services to children, youth, young adults, and their families. And so that brings me to the end of what I wanted to present today. So at this point, I would open it up for questions. I know we have a number of members of the media on the line with us today. So I'll invite anyone with a question to please unmute your microphone now and ask away. And I'm just going to actually put on some headphones so I can actually hear you if you're going to talk to me. Oh, I will try to put on my headphones, except it will not turn around. Oh, there we go. Okay. Okay, so now I can hear you. If anyone wants to ask a question, feel free to unmute yourself and just fire away.
Hi, Ainsley. It's Michael Delamonte here from CTV. Can you hear me?
Hold on. I actually can't hear you. Is that better?
Hello, Ainsley. Can you hear me?
Hi, Michael. Yeah, thanks.
Wonderful. So yeah, Michael here with CTV. And I know you touched on this to a good degree, and it's probably outlined in the report. But I'm wondering if you could speak to just the number of deaths that occur in relation to sleep-related infant deaths. That was poorly worded. Yeah, if you could just speak to kind of the some of the practical implications of a lack of addressing of this issue. How many children die of this, and how many communities are or what type of communities are largely impacted?
Sure. Thank you for that question. So a lot of that data you can find in great detail in our 2020 report, the Safe and Sound report, and we can send you a link to it. Or I think actually Jessica probably put it up in the chat function while I was speaking about it. But you know, I would say on average, I think we're seeing at least 1 or 2 every month. being reported to our office. So, 13 or 14 every year on average, although I believe it was in 2018, and I'm going off the top of my head. So I believe it was in 2018 where we actually had reports of 28 infants who died where there were unsafe sleep environments reported by the chief medical examiner. And so this is a really pressing issue, because these are preventable deaths. These are deaths where, everybody wants to do their absolute best for the infants in their care. And one of the things that we found in our research was that caregivers, parents, grandmas, aunties and uncles, anyone who has the responsibility to care for infants really wants to do their best job. And so one thing that's really needed is information and education for caregivers. But there's, in that report, we outlined 13 different recommendations, and some of them are actually would be relatively simple for the government to implement. There's one in particular that speaks about, there used to be an interdepartmental working group on infant mortality in our province many years ago, and it was disbanded. But that group was tasked with monitoring and watching that issue to ensure that government departments had up-to-date data and information on why it's so important to ensure that infants are sleeping in safe environments. And so that is one of the recommendations that we made in that report, was for the government to reinstate that committee, which would be, sort of, that low-hanging fruit, if you will, that could happen relatively quickly. Some of the recommendations that we do make in that report are a little bit larger, broader, systemic pieces, but some of them are relatively simple, or would be simple for the government to implement, and that's why we're urging action today on those.
Oh, Ainsley, can you still hear me?
Yes, I can hear you. Thank you.
Oh, yeah, I just as a follow-up, I wonder if you could speak to just some of the services that are lacking when it comes to youth and mental health and substance use services as well. If you could kind of address it in similarly to how you just did on some of the practical things the government can do almost immediately to help address this, because I know it's a very large issue. I'm just kind of wondering what can be done at the ground level relatively easily to help address this.
Sure, thanks for that question. So there are a number of recommendations that we have open right now that speak to mental health and substance use treatment services for young people. And some of them are those larger pieces that require, the development of facilities and new infrastructure. But there are also, quicker wins that the government could take on. They will require investments, and they will require reallocation of resources to some of the existing services. We have incredible service providers in mental health and substance use treatment here in our province. We just don't have enough of them. And so one of the things that could be done relatively simply is in investing larger amounts of money into those systems for young people. We hear all the time here at our office through our advocacy services program how hard it is for families to find mental health treatment and support for their young people, and that wait lists are growing, that some wait lists are upwards of 12 to 14 months in some cases. And that's a really unacceptable length of time in our province for young people who are in crisis and need help now to have to wait for, upwards of a year and more to get the critical support that they need. And so what we're seeing is that in that absence of ongoing services that are available to young people, we see more pressure on the emergency care services, like the emergency rooms and places where kids are going or are being brought when they're in really critical crisis. But what we need to do is ensure that we have services here in our province that that sort of swim upstream for kids and do some of that early work, but then when they really need services in their lives, that they don't have to wait for, a year or more to access them. So investing in more availability of resources would be really important. And then there's also things like entrance criteria that can be really prohibitive for young people to be able to access services. So, things like requiring a permanent address before you can access certain services, or having rules about whether kids are allowed to smoke cigarettes, for example. Those kinds of things. When you're battling something as significant as like a meth addiction, for example, cigarette smoking is not necessarily the piece that we really want to focus on. We want to focus on bringing in those young people for treatment who really need that support and services, and figure out, what are the most critical issues that we need to address now, and making sure that services are really welcoming and open, that they have extended hours, that they can do intakes on the weekend. Those kinds of things are really going to be really important. Anyone else have any questions? Thanks for those, by the way, Michael. Okay, so not hearing any additional questions for right now. I would just remind media folks in particular that that if you want to arrange for a one-on-one, I am available for those later on today. I know that some of you have already reached out to Jessica, so you have Jessica's contact information. Please feel free to reach out to her to set those up. And so before we close, I just wanted to thank everyone for joining us today. And our contact information, I think we're going to put it up on the screen right now. And our social media handles are up there as well if you want to follow along. You can find the full report on our website right now. And our social media channels will be including a bunch of that information in the days to come. So thank you very much, everybody, for joining us today. Stay safe and warm, everyone. We'll talk to you soon.